Start, ma'am.
So, good evening, everyone. I'm Dr. Sayali. I'm the Fertility Specialist and Junior Consultant at Oasis Fertility Pune at the Karadi Center. I welcome you all for today's Facebook Live session, and our topic for today is practical steps to improve the sperm count. Now, the male factor is like solely responsible for 30% of the total infertility, and somewhere it contributes along with the female factor in another 20 to 30%. So, male factor is somewhat responsible for around 50 to 60% of the infertility. So, in today's session, we are going to deal with what are the practical tips where we can, help these individuals to improve their sperm count or improve the sperm parameters. Now, to here we are going to understand the various reasons that can result in decreased, semen parameters and how can we deal with them. So the main causes of decrease in the sperm count or decrease in the quality of the sperm is kind of divided into three main causes. So initially we have the hypothalamic or the pituitary cause. Now the hypothalamic or pituitary cause, this can be because of some form of infection. There can be some, there can be some tumors or any form of trauma or any genetic conditions. Now basically when the hypothalamus or the pituitary gland is involved, the gonadotrophin production or the hormone production is kind of affected. Now, here the gonadotrophins, the hormones like the FSH, LH, the testosterone level, now these levels are going to be less. So, in these individuals which have some problem with the hypothalamus or pituitary, now here the semen count, motility can be increased by giving them gonadotrophin injections. Now, these injections can be in the form of HMG, where we can give them 75 international unit once a week for a period of 6 to 8 weeks. Or we can also give them HCG, which is like a surrogate LH. Here, HCG in a dose of 1500 international unit can be given like 3 times in a week for a period of 6 to 8 weeks. Or certain medications can be given like clomiphene citrate or letrozole can be given. The total duration of treatment can be around 6 to 8 weeks. Then we can evaluate these individuals again to look whether the count and the motility is improving, and then or we can continue the treatment further. The second cause can be the testicular cause. Now, here the testes which are involved in the production of the sperm, the spermatogenesis process. Now, the testes can be involved in like genetic conditions. Here, the sperm production by the testes or the capability of the testes to produce sperm is affected. Then the testes can also be hampered because of some infections, certain conditions such as varicocele. It can also be because of trauma, or it can be because of certain genetic conditions such as Klinefelter syndrome, in which the main function of the testes is gone. Now, in this, what we need to do is we need to treat the conditions which are causing the decline in the semen parameters. So, if it is because of varicocele or if it is because of any form of infection, we need to treat those, because in these conditions, mainly the oxidative stress is increased. And this oxidative stress is going to hamper the semen parameters. So we can, treat the infection. The varicocele can be corrected in the form of varicocelectomy, or we can give them antioxidant that can, help in improving the semen parameters. Now the next factor is, conditions like when the sperms are produced, they are stored. Now conditions that will, prevent the release of the sperms, that is the outflow tract of the sperms is affected. Now these are the obstructive conditions. Now whenever there is obstruction to the sperms, then you can attain fertility, by removing the sperms directly from the testes. This can be in the form of TISA, that is a testicular extraction of the sperm. Now, in individuals where the hormone levels are also elevated, this kind of indicates that the testicular function to produce the sperms has kind of declined. Therefore, we can go ahead with the procedure that is known as microtesy. In this, under the microscope, we can evaluate the areas where actually the spermatogenesis or the sperm production is taking place. And in these individuals, we can retrieve the sperms through a method that is known as microtesy. Now, these are like the causes, which can result in decline in the sperm production. Now, let us go to the diagnostic modalities. Like, how will we come to know, like, if the sperms are affected, or what are the other tests, by which we can diagnose these conditions? So, the prime test will be the semen analysis. Now, the semen analysis will be done after an adequate abstinence period of 3 to 5 days, in which the patient has to ejaculate the complete sample. According to the WHO parameters, we require a volume of around 1.4 ml. The count should be 16 million. The motility should be around 32 to 40%, and the morphology or the good sperm should be around 4%. In the semen analysis, we can also look if there is any evidence of infections by counting the number of pus cells that are there. So if there is any infection, we can treat it likewise. Then to diagnose conditions such as if there is any varicocele, any hydrocele, or to to actually see if the testes is normal in size or the testes is small in size, which is seen in conditions like where the testicular function is decreasing. We can go for a scrotal Doppler and we can go for a USG. Then other kind tests such as we can go for a sperm DFI, which is the DNA fragmentation index. In the sperm DFI, we will come to know what percentage of the sperms are actually DNA damaged, and based on that, if it is less than 25, then we can go for the normal selection. Otherwise, we can use methods for the selection of the sperms, or we can go for direct retrieval of the sperm from the testes. Other test which can be done is we can go for a testicular aspirate or testicular biopsy, where we will come to know if there are any areas of sperm production that are present. We can go for certain genetic tests, as we have seen in the causes of decreased semen parameters. There can be some genetic causes, so we can go for the karyotype, which will help us know about the conditions such as Klinefelter syndrome. Then in conditions where there is severe oats, where the semen parameters are severely affected, or when there's azoospermia, we can go ahead with tests such as the CFTR gene mutation or the Y chromosome microdeletion. So these are the basic tests that are commonly done, which will help us to evaluate these conditions. Now here, till now, we have dealt with what are the surgical methods or what is the hormonal treatment that we can, do for these individuals. Now we will, go through some of the common things that these individuals should follow that will help in improving their semen parameters, or that will help in, preventing the decline in the semen parameters. So first of all, a healthy lifestyle and adequate weight to be maintained, because lifestyle, adequate weight, if there's obesity, kind of the oxidative stresses increase, and this can kind of affect the overall parameters of the sperm. This can affect the count, motility. This can affect the overall volume of the sperm. So having a good diet in form of good green leafy vegetables, adequate amount of antioxidants in the diet, maintaining a healthy lifestyle, adequate exercise, maintaining an adequate BMI, all this will help the individuals to improve on their sperm count and motility. Then to any form of drug abuse, the use of excessive steroids, as all of these kind of increases the oxidative stress, and this can damage the overall quality of the sperm. This can also affect the motility or the overall count of the sperms that are there. Then since now everyone is going through a very stressful lifestyle, so decreasing the level of stress, as again the oxidative stress in these individuals is increased because of stress, and they can kind of overall affect the parameters. Again, avoiding excessive exposure to heat, avoiding excessive exposure to radiations, or excessive use of cell phones or laptops, that is commonly done nowadays. Avoid exposure to any chemicals or any pesticides, heavy metals such as copper, cadmium. These all kind of have shown to decrease the quality of the semen parameters. Coming to certain medications, if the individual is taking, avoid certain antibiotics like gentamicin, erythromycin. They can also avoid use of steroids, use of exogenous testosterone that is taken, then use of antipsychotic or any antidepressants, because these are the things that can affect your seminal parameters. Now these are the things that you should modify in your life, certain things that should be avoided, so that to have a better lifestyle and kind of improve your semen parameters. Now there is a very important role of certain vitamins and antioxidant. Now, as we know, antioxidants are important because, as we know, oxidative stress, the reactive oxygen species that we see, play a very important role in decreasing the quality of the sperm, decreasing the overall seminal parameters. So antioxidants are required. Along with them, certain vitamins that are required is, we require vitamin C, we require vitamin D, vitamin E, and vitamin B12. These are all required in adequate amount. Vitamin E in the dose of around 300 to 600 milligram. Vitamin C around 1000 milligram per day. Vitamin B12 around 1000 to 1500 microgram. Vitamin D, we also require zinc and folic acid in the adequate amount, because all of these are kind of required to maintain the proper semen parameters. And if there is any deficiency of these, they should be supplemented. And the treatment in individuals with abnormal semen parameters, they should be given at least for a period of 3 months. then you can reevaluate these individuals to check if there is any improvement. And this treatment can be continued for a period of 3 to 6 months. Coming to the antioxidants that we've spoken about, antioxidants like your L-carnitine, your lycopene, CoQ, selenium, all of these are required to be given, to improve the overall count and motility of the sperms. Okay, so we have dealt with, what are the, changes in your lifestyle, what are the certain exclusions from your lifestyle that needs to be given. The vitamins, the, antioxidants need to be taken in the right amount. And apart from them, there are certain causes that will affect, the semen parameters. So they need to be evaluated likewise. So I hope that whatever I've spoken about till now kind of has helped you people in understanding this topic. So we will be taking a few questions that are coming over from our viewers. So the first question is, how can I increase my sperm count easily? So as I said, after doing the semen analysis, once you get the total count and motility that is there, the first prime initial step will be to maintain an adequate lifestyle, to take in good amount of antioxidants, have a good diet, maintain a good BMI, adequate sleep, exercise, decrease your stress levels. Your vitamins and antioxidants taken for a period of at least 3 months will help you increase your sperm count. Okay. The next question is, how can I solve low sperm problem? To solve the low sperm problem, as we have said, that there are various causes by which the sperm count can be low. So we need to actually evaluate those causes. We need to do certain tests, like we need to do a semen analysis. We need, if the count is very low, we need to do your sonography. We need to get your hormonal assessment done, and based on that, then whatever the causes are, we can go for the treatment likewise. And as we have spoken, your lifestyle, your diet, exercise, the supplementation, that can help you in improving your low sperm count. Okay, the next question is, which food improves the sperm count? So the foods which are rich in antioxidant, like you can consider the green leafy vegetables, good protein foods, fresh foods that are made, protein rich food. These kind of improves your sperms. Okay, then what are the chances of sperms in 5 days? I mean, I think the question says that what are the changes that can take place in the sperm in 5 days? So, adequately, we say that the abstinence period should be a period of 3 to 5 days. So, if it is less than that, so maybe the volume of the sperm will be less and we won't be able to evaluate better. And if the abstinence period is more, then the storage of the sperm is increased. So, we will have more amount of dead sperms, and therefore to evaluate your sample better, we need a proper abstinence period of 3 to 5 days. Okay, so what time of the day is the sperm count highest? So probably the sperm count will be highest in the early morning sample. Okay, so I would like to conclude my session here. Hope that the session has kind of solved your doubts and helped understand this topic better. So for any query or any doubt related to this topic or any help needed, you can dial the helpline number that is given below, or you can meet us physically at any of our two centers, that is Oasis Fertility, Adisa Avenue at Kharadi, or Oasis Fertility, Kaspate Basti at Wakar. Thank you.